Trump stop that. Trump say nothing can block me now, Jay. They say, you get them fact checkers.
Say what you want.
Fact checkers gone. Yeah. Okay. Now, prostate cancer. Okay. All right, let's go. Let's build up the life. We're going to talk about the men tonight. Men's health, men's prostate cancer, men, and BPH and prostatitis and all these troubles in the men's prostate gland.
Mm-hmm.
Yes, sir. We'll talk about that tonight. Then we're going to burn it tonight. So, you know. Yes, sir. Let's talk about sitting in the middle asking. Build up the light. Good. Send me the link for the other. All right. Don't forget, if you're a woman, have your man next to you right now, because a lot of us men don't want to face the fact that we get in trouble with ED and impotence and prostate cancer. You know, so get the man next to you. Hey, get the man next to you, baby. Blessings and greetings in the name of the Most High. Blessings always. And tonight we will have a very, very significant presentation on prostate cancer and BPH, benign prostatic hyperplasia in us men, impotence and ED, called bad circulation in the penis. We're going to more concentrate on prostate cancer because, brother, am I lying? If I lie, tell me I'm lying, right? We had a gentleman come in with prostate cancer, and he have a catheter in his penis, you know, yeah. So usually, if we have an enlarged prostate gland, the prostate gland goes right under the urethra, and it squeezes the urethra that carries the urine, and then we can't urinate as men, because as we get older, the prostate grows also, unless we can take care of the prostate gland, yeah? So the brother came in, older gentleman, prostate cancer, and he came back to the right brother?
Yes.
Put him on a put, he's amazed. And we sending him back to his urologist, because as I said before, we have to work with a urologist. When he goes back to the urologist, he's going to take all that catheter in his penis, because he says he's peeing like crazy now, because now we are shrinking his prostate gland. Yeah? So tonight what we're going to do, we're going to teach brothers, yeah, how to prevent prostate enlargement and prevent prostate cancer, but also how to prevent your prostate gland from becoming enlarged. So you don't have to put a catheter in your penis, can't pee. There's no sex when you put a catheter in there. Penis gone. You understand? Warning you all men. So we're going to talk about from the age of 17, 18, when testosterone is at peak, and at 40, 50, when testosterone is tapering down. How you can get your sex life back. 70, 80, 90, and still banging, you know what I'm saying? So let's go to the brother, we're going to talk about that, but first we're going to give thanks and praise to the Most High Jehovah God, Yahweh. Yeah? Ultimate healer of all things. See my son right here? I warning him. That's my big son. I warning him. I tell him too much sex is no good. Yeah? I warning him from young. From now. I tell him all, you can't kill the pussy cat. That's my son right there. All right. Wonderful. So we're going to talk about prostate cancer and BPH prevention and treatment. Yeah? Now, BPH is benign prostatic hyperplasia in the medical term, meaning that the prostate is enlarged. Yeah? As I said before, your prostate grows as we get older if we do not take care of the prostate gland, because a lot of black men doesn't know how. And we find that lots of our young brothers in the 40s and in the early 50s is now coming down with prostate cancer, or prostate enlargement, or prostatitis, or even troubles in the urinary system, yeah? So although the prostate is not part of the urinary system, because of where it is located, it can cause us men to have troubles in that area. All right, and that's the reason why when you have BPH, benign prostatic hyperplasia, and the prostate become enlarged, it squeezes the urethra so we can't urinate. Yeah? Wonderful. So we're going to get into BPH, prostate cancer, impotence, ED. Your penis can't get hard. Blood can't flow. Right. Now, we said before, and we want to say it again, we're going to come back and we're going to try to educate our men. Our men. And I want to concentrate on black men, because our brothers is dying from prostate cancer at 45. Our brothers in the black community, because we are ignorant of the fact, not knowing how the prostate work, we are dying from prostate cancer in the 50s. Our brothers. And then the man in the white coat, he removes your prostate gland. You see? And then he removes it, and then he said your cancer is, you're cancer free. But after 2 years, although he removed this gland, your cancer come back. Because he only removed the part of the body that have the cancer. So we are trying to educate our young brothers who's growing up. So you all don't make the same mistake that lots of us made. All right, so we're trying to teach you all. All right, now, this is a normal prostate. And this is a cancerous prostate. This is where the prostate is located, under the urethra. And the urethra carries the urine. So come over here, sir. Come over here, closer now. See, right here. So this part of the anus is where the doctor will put his fingers, and he can feel the prostate right here. So this part of the intestines correspond to the prostate, and this part of the intestine corresponds to the woman's uterus and the genital areas. Yeah. Now, when a man go to the bathroom and his feet is on the ground, this part of the colon, called the sigmoid colon, squeeze a lot. And when it squeezes, lots of the waste matter get into the prostate gland, or you get hemorrhoids too, or polyps in the sigmoid colon. Yeah. So what we advise lots of men to do is, when you're going to sit on the toilet bowl, you elevate your feet, and when you elevate your feet, this part of the colon relaxes, the sigmoid colon that is, and the waste matter comes out without seep into the prostate. Although they have capsules, the waste matter can stick around the capsule and cause damage to the prostate long term. One, cholesterol. High cholesterol also can seep into the prostate gland and cause you to have prostate troubles, and you might think, because you have a high PSA, that you have cancer in the prostate gland, but because there is lots of cholesterol clogging up the prostate gland, causing your PSA to rise. Yeah? Over here, sunshine. Back over here. All right? So, we know now that because the prostate gland is located under the urethra, yeah, if the prostate become enlarged, it can squeeze the urethra, and we as men cannot go to the bathroom to urinate. Yeah? Long term, if we don't take care of the prostate gland, then the prostate gland become cancerous. And then you have what we call a compressed urethra, and then you have cancer, and you can't pee also. That's problematic for us men. Yeah? Now we're going to teach you how to keep the prostate like this and prevent it from coming like that. Yeah? All right. We did this already before, we wanted to re-educate, because men ain't listening. You're all taking your prostate gland. You know what I mean? In 1999, there was an estimated 179,300 cases, with 37,000 deaths in men in America alone. And in 2023, 24 is getting worse, because more men, over 235,000 men or more now, is coming down with prostate cancer, prostate enlargement. And the numbers are dying from prostate cancer is even more. Yeah? So we have to educate our men on how they can take care of the prostate gland. Yeah? Prostate cancer. We just said before that because the prostate is located under the urethra that carries the urine, if it becomes enlarged, it can cause us to have trouble in the prostate gland in terms of urination. And the doctor do not know how to shrink your prostate gland. We're going to teach you how to do that, because he do not know how to shrink your prostate gland. He put what? He put a catheter in your penis. Yeah, because you can't pee, because the prostate is enlarged. See, it compares to the urethra. See? Yeah. Now, when you put the catheter in your penis, you can get retention of urine, and you can also get infection, because not all the urine is coming out, because remember you have a catheter in there. So lots of men who have the catheter in the penis, they also have to take antibiotics, because they cannot remove a lot of the urine. That's number one. Number two, because the catheter is there, very painful though, you start to get lots of pain and lots of infection too. Yeah, because there is something in the penis which not supposed to be there. Number three, he, the doctor, can do a TURP. A TURP means that you take an instrument and he put it into the penis hole, and he goes up with the camera and he scrapes the prostate gland. If you have BPH, benign prostatic hyperplasia, yeah, it makes you pee, but 2 years it comes back because you go back to the same thing again. Yeah, so that's when you have troubles with BPH, benign prostatic hyperplasia, prostate cancer. Now, if the cancer is in one lobe, yeah, they stage you. They give you what we call a Gleason score in the medical system. If the cancer is in 2 capsules, the Gleason score rises. We're going to teach you what they are in a little while. Yeah? So you have 1 capsule, 2 capsules. So this cancer here is in 2 capsules, making it more aggressive and come out of the prostate gland to go into circulation, to go into the man's bones, in his spine, in his lung, in his lymph system, and then the man dies from prostate cancer. Yeah? Long term. And lots of, I think it's Hulk. Mm-hmm. That's what he died from. Bill Baxter, he died from prostate cancer. Lots of actors, and even another big actor again, he died from prostate cancer too. And they had a lot of money, so money can't save you. Yeah, you have to take care of the prostate gland as a man. Women, teach your men. Right now, risk factors. Risk factors, age. So the older you get, is the more the prostate become enlarged and become prone to becoming cancerous. Yeah, but that doesn't necessarily mean when you get older you're going to have prostate troubles though. See? Unless you're not taking care of the prostate when you were younger. It catches up with you when you get older. Yeah? Young brothers, start listening. Race. Black men, African American men from African descent have more prostate cancer than any other race. Facts. Do the research. Studies. The man who's in Africa, prostate cancer is unheard of. But when the African migrate to the West and he incorporate the Western man diet, he start getting prostate cancer faster. Yeah? Family history and a genetic predisposition. Meaning that if your father had it, your uncle had it, your grandfather had it, and you follow the same pattern, you can get prostate cancer eventually. Yeah? And when you lose the prostate gland, you become like Lazarus, your penis dead. You're going to look at a woman and just start scratching your goddamn head. You can't have no sex no more. Don't remove it. Save it. Reproductive factors. Mainly that you have STDs. If you have gonorrhea, syphilis, they can cause you, the individual, to get prostate cancer faster, and dietary factors like fat, lots of fattening foods, kill the prostate gland. Cholesterol, for instance, will clog up the prostate gland eventually. So those are risk factors, yeah, of prostate cancer. Now the doctor was doing a PSA called a prostatic specific antigen test. Yeah? DRE mean a direct rectal examination, meaning come over here, son. You're going to put his hand in your rectum, DRE, and he feels the prostate. If the prostate is hard, he will say, you look at you got prostate cancer, let's do a PSA. And we're going to give you the number of the PSA, proving that you don't or you do have cancer. the DRE, right here, feels the prostate. You say, oh, prostate is too soft. It's too hard. If it's too hard, it's no good. It's no good. Now, they can take an ultrasound of the abdomen and pick up the size of the prostate gland. Now, if the prostate gland is supposed to be, 4.5 centimeters? If it's 6 centimeters, here the doctor will say to you, your prostate is enlarged because now the centimeters is higher than normal. Okay, come over here, Santa. Wonderful. We just talked about truss a while ago. The truss where they put that instrument in the penis hole and they start scraping the prostate gland, and they will cause it to urinate, but after a couple of years they come back again. Right? It's called truss or transrectal ultrasonography. Yeah. Now, when you go to a urologist and he starts looking at your PSA, he starts to grade you. So you have 1 + 1 is 2, 2 + 2 is 4, 4 + 4 is 8. That's problematic. He called it a Gleason score. Yeah? So when you have a grade 1 to 5 Gleason score, the doctor knows that you are well differentiated, 1 well differentiated to 5 undifferentiated prostate cells. Gleason score 2, 1 + 1. If you have the score 5 + 5 is 10, he knows for a fact that the cancer is what? Is in what? 2 capsules. And the cancer is coming out of the capsule now. So your grade is higher. They call it the Gleason score in the medical system. Yeah? Black men have to learn about these things because you're dying from prostate cancer in the 40s. Yeah? And when you have prostate cancer in the 40s, it is very aggressive. It's not like the older men who have it in the 80s, and the doctor will say, you know what, you're going to die from a heart attack, because the older man, when he has prostate cancer, the cancer is slow moving. So he can die from a heart attack than prostate cancer at the age of 80. Don't forget that. The younger you are, the more aggressive the cancer is. Okay? Wonderful. We go again. So we're talking about score. Gleason score, 2 + 2 is not bad. 1 + 1 is not bad. See, 5 + 5, boom, that's it. Cancer coming out of the capsules. Yeah? Now, when he starts to stage you now, he starts looking at your PSA. We're going to teach you that now. Teach about the PSA also. A1 tumor have a low Gleason score, meaning that it is not in the end of the capsule of the prostate, but is intact. Yeah? A2, the tumor presents a higher Gleason score and possesses capacity for metastatic moving onto the prostate gland. See? So if you have a Gleason score of A2, we know for a fact now that the cancer is coming out of the prostate gland. Stage B, the tumor is confined to one lobe of the prostate gland. See? B2, the tumor involves both lobes of the prostate gland. The tumor is involved in what? Both lobes of the prostate gland. 2 lobes. Yeah? Not 1 lobe now. See? So it's more aggressive now because it's in 2 lobes. Don't let it get into the prostate eventually. Yeah? And all, period. Yeah? B2, the tumor involves both lobes of the prostate gland, and now it's looking to come into the prostate. Yeah? Stage C. C1, evidence of extension. Meaning that the prostate is enlarged, extending, and because it is under the urethra, the cancer is now eating away the prostate gland, and it is extending, coming out. C2, the tumor producing bladder obstruction now because your prostate is so enlarged, and the cancer is growing, so it's causing you to have trouble in the bladder. You can't go to the bathroom. He had to put a catheter in your penis. You can't pee. And the woman going to look, and she said, oh my goodness, I can't have no sex tonight because there's a catheter in my man's penis. And sometimes you have to keep the catheter in there for years. But we're going to show you how to shrink the prostate gland. Stage D, metastatic prostate cancer, meaning that now D1, the cancer is in lymph node involvement, and 2, distant metastatic involvement. It is in your bones. It is in your lung. It is in your liver. And that's when you start to have more troubles now, because once a cancer gets into an organ and disrupt the function of that organ, then you are in problems long term. Yeah? So we have to make sure that we don't get prostate cancer. Or if you do have it, like we're treating a few brothers who have it, and they're doing pretty well. Like the gentleman today came back, he's doing good. We're going to send him back to the urologist and take out the catech in his penis. And we have another brother T. You know who you are. Hope you're on the live. He's doing pretty good also. Yeah, with his prostate. Yeah, and his kidney too. Yeah. Now we're going to talk about these herbs in a while: saw palmetto, white sage, stinging nettle, coranzonia, corn silk, hydrangea, zinc supplements, cleavers. We're going to talk about them. What they do. Yeah. Now, in studies, vitamin E in prostate cancer treatment has shown to inhibit cancer growth in human cells as well as cell culture studies. Not Patrick Debs. MCP, modified citrus pectin, from what? Oranges, tangerines, grapefruit skin, lemons, key limes. It prevents the spread of prostate cancer by inhibiting what? The binding ability of what? Cancer cells. They don't teach you that. Because all they know is chemotherapy and radiation and surgery. See, but I'm teaching you now. Black men. Yeah? So if you want to help vitamin E with the prostate gland, vitamin E is very significant. 800 IU per day. Dry E. Not the gel E. Dry E. DRI. Yeah? Aged garlic, zinc, specs. We have specs, right? Put out spec for them in a little while. So I learned specs because now specs, they have to go on the ground. Because specs been fixing prostate cancer. And they run the doctor who was doing specs. But you know what? I say, you know what? I'm going to follow the doctor now. When I started putting some herbs together for specs, I have it as specs. So you take specs with all the things you're going to teach you what to do, you're going to fix your prostate cancer. Don't take out your prostate gland. Yeah? B-complex men's multivitamin from what? Over here. Men's multivitamin from Ambrosia. See it here? Where it is, here? With saw palmetto. To fix the prostate cancer. Hold the immune. Let's go over here. Now, let's talk about nettle root and saw palmetto. What do they do, Patrick? Nettle root, not nettle seed, not nettle leaf, nettle root and saw palmetto. They act as 5-alpha reductase inhibitors. They act as 5-alpha reductase inhibitors. What is 5-alpha reductase, Patrick? 5-alpha reductase is an enzyme. Yeah? So that enzyme helps to increase dihydrotestosterone, which is the culprit of us men getting prostate cancer. Look it up for me. Dihydrotestosterone. Saw palmetto and nettle root is very significant because they act as a 5-alpha reductase inhibitor, but they can also inhibit prolactin and aromatase, phospholipase A2, and estrogen receptors in men's prostate tissue, preventing you, the man, from getting prostate cancer. Or if you do have it, it helps to reduce the 5-alpha reductase inhibitors. See? Because once you cannot inhibit 5-alpha reductase, you start to get a high level of what? Hydrotestosterone. It's just like when you have heart disease. Yeah? You have to get rid of that enzyme or that amino acid. Yeah? Because if that amino acid become high, you get trouble with heart disease. If the 5-alpha reductase is not inhibited, then the hydrotestosterone will rise and put us men at risk of getting prostate cancer long term, especially when you pass the age of 30. Yeah? Look it up. Educate yourself. When these two herbs act as 5-alpha reductase inhibitors, when they also inhibit prolactin, yeah, aromatase, and phospholipase, and when they inhibit the estrogen receptors in our men, in the men's prostate tissue, it reduces inflammation, number one. You don't get BPH, number one. It reduces inflammation. It inhibits the growth of the prostate tissue while reducing benign prostatic hyperplasia symptoms. Prostate enlargement. So when you take these herbs, it reduces the inflammation and it also inhibits the growth of prostate tissues while reducing the enlargement of the prostate gland. They don't teach you that. Next one is called stone root. Let me give you a few of them, you know. It's called collinsonia. This herb acts with gravel root. If you have kidney stones, it helps to remove kidney stones because it deals with what you call vascular integrity in the man's prostate tissue. But it also reduces congestion in the prostate gland while inhibiting dribbling. When you go to the bathroom, you can't pee, you're going to dribble. Small shit coming out, small little pee coming out. It stops that. And it also prevents prostate inflammation because it deals with what? Vascular integrity. Yeah? It keeps the veins strong. So it's also good for men who are suffering from ED, erectile dysfunction. White sage, not red sage, not black sage. White sage shrinks the prostate gland, preventing inflammation. White sage, I'm going to say it again. White sage shrinks the prostate gland. We don't give you Hytrin. We don't give you Lupron. We don't give you Proscar. We don't give you those because you got to take them for the rest of your life. You know what I'm saying? We give you white sage. If you have benign prostatic hyperplasia, because it shrinks the prostate gland. Yeah? Preventing inflammation of the prostate. Yeah? While we are using the nettle root and the sulfur metal to act as 5-alpha reductase inhibitors, and also acting as inhibitors of prolactin aromatase and phospholipase and estrogen receptors in the tissues of the man's prostate gland. That's what they do. But because a lot of our men is not educated, you all go and you all take the man tell you all you have prostate cancer. You all go, well, I got to take on the prostate because you tell me I have prostate cancer, but your cancer come back after you remove it, and your sex life gone. And then another man have to come into your cane field, eat your cane. Yeah? At 45 years old, you're crazy. Other herbs that is very significant for the prostate gland, Magadon woman for your old man, pipwissa, corn silk, pygeon bark, couch grass, cleavers, butchu leaves, hydrangea. Those are the herbs that can be used to prevent benign prostatic hyperplasia, enlargement of the prostate gland. Or if you have prostate cancer, we can give you these herbs to work to help to keep the prostate healthy. Yeah? Those are herbs that you can use. Yeah? All right, now, for the sex drive now. Sex drive in men. We're going to talk about that now. Yeah? You know for a fact when you get an old, your penis going dead like Lazarus. A lot of young brothers cannot get an erection. Or a lot of young brothers could get an erection, but they can't keep it. You know what I mean? And then the woman started to laugh at us. You think he's so bad. You know what I'm saying? So we're going to teach you now how to keep the penis healthy to prevent ED and prevent impotence. Yeah? All right. I ain't reached there yet. Wonderful. All right. Now, let's go to the PSA. The PSA, prostatic specific antigen, it is a antigen called a protein that is abundant in the prostate gland. he, the doctor, will take a PSA, and in reality, in their system, the PSA goes from 0.0 to 4.0. Now, once you go to a doctor, urologist, they're very important now, and he see that your PSA is 5.0, he tells you, we got to do a biopsy of the prostate gland. Yeah? At 5.0 though. Yeah? Now, you can have cancer in the prostate gland at a PSA of 5.0, 10.0, 15.0. Yeah? And you can have cancer at a PSA of 2.50. I want men to follow me now. So even though you have a low PSA, you can still have cancer in the prostate gland. Or you can have a high PSA and still have cancer in the prostate gland. So he removed 6 pieces of tissues from the left capsule of the prostate and 6 from the right capsule of the prostate gland. Now, lots of doctors are telling us now that they don't believe in biopsies because they're saying that biopsies can disturb the cancer and cause the cancer to move out of the prostate gland into circulation. So now, not all doctors, but lots of them is looking for less invasive ways of checking us men to see if we do have prostate cancer without the biopsies. So they go to what? The free PSA. And they will tell you from numbers. Stay right there, son, sir. Educate my brothers. Brothers, you have to be educated. Because you're going to take out your prostate gland at 45, and then when you come back, you're going to tell you, no, where you're going to have your sex life back. He's lying to you. Your sex life going to be dead, dead, dead. Your woman going to be bawling, bawling, bawling. And then somebody come in your cane field and say, he's dead like Lazarus. Okay. Now, once you have 5.0 PSA, your cancer, if the biopsy says it's cancerous, it is still in your prostate gland. It didn't come out yet. If your PSA is 10.5, the cancer is still in your prostate gland. If the PSA is 20.5, the cancer is still in your prostate gland. If the PSA is 50.5, now the cancer is coming out of the capsule and is going into circulation to either go into your spine or your bones. So you can have a PSA of 5 or 10 and you can keep it right here and your cancer don't harm you at all because your prostate gland is not an organ. I want to call to debate any urologist on TV, on presentation, and ask them, hey, urologists, tell me, if a man have a PSA of 10.5 and he has prostate cancer, and he can keep the PSA at 10.5, is the cancer going to kill him? He can never say yes. He can't. Eh? Because the cancer is not out of the capsule unless he, the doctor, pinch out these tissues of the prostate gland and disturb your cancer. Yeah? We had an African professor who had a PSA of 6,900 and was an oxycodone. And he came to Greenland. We take him off for what? In 2 weeks. He went into what? 690 milligram. See? PSA. Yeah? Angel on Hand, are you on the live? Tell them what it is. Angel on Hand introduced his brother to me, a professor from Ghana. Was in the next in line to be the king of Ghana. Yeah? In 2 weeks. Yeah? So, when you have a PSA of 200 or more, now you are in problems now. Because the cancer is out of the capsule of the prostate gland and it is in your bones. And once the cancer gets into your bones, it is difficult to repair it. You see? Yeah? So he, the doctor, will do a what? He will take out your prostate gland And when he takes it out, your PSA goes back to what? 0.00. That's good. Yeah? So then if that's so good, after 2 years, while you come back to me in Ambrosia and show me your PSA, is now what? Rising back again to what? 5.0, 5.6, after your prostate was removed. Yeah? Because your cancer came back. So when it come back, he goes now and he gives you what? I'm going to educate you all men. He gives you an injection called Prosca or Lupron. So they block testosterone. Or he remove your balls. I'm being blunt. Your balls, the testicles. Because you know for a fact that us men testicles makes testosterone. And you know for a fact that the prostate gland, if it's there, it produces a prostatic fluid that secretes and send into the testicles to give the sperm the good velocity. So when he realized that your prostate come back, after he remove your prostate gland, he go and he castrates you by removing your balls and your testicles. Okay, that's all good. Your PSA drops. But know what he does? He put your what? Adrenal glands. ADRENALS. Adrenals. In what? In overdrive. OVERDRIVE. Adrenals in overdrive. So once your testicles is gone, he put your adrenal glands in overdrive. And your adrenal glands say, no prostate gland, no testicles. So me, adrenals, I am going to produce lots of what? DHEA. And I'm going to convert it into what? Testosterone. And then he does what? He comes and says, oh, shoot. Your testicles are gone. But now the adrenals is in overdrive. So he gives you estrogen receptors. And he make your breast get big like a woman. Yeah. No, your wife has to suck your breast because no, you have titties now. You see what I'm saying? Yeah. And after you give you the Prosca and the Lupron, yeah, or you give you bacteriotherapy, the Lupron and the Prosca, after a while the cancer say, I get used to your ass, man, Prosca and Lupron. Every 3 months I'm going to take that. I got used to that. And then after that, you still die from prostate cancer. So the key is to prevent prostate cancer. Don't get it? Now, let's look at some sex drive now. Teach you. Clean the prostate out. Do your prostate exercises. Do your Kegel exercises of the prostate gland. Keep it healthy. You know, make it strong. You know? Don't have too much sex. Too much sex is no good. No sex is no good either. But you're having too much sex. You know what I mean? You want to sex the woman Monday, Tuesday, Thursday, Friday, Saturday. You think you're killing her pussy cat? You're killing your goddamn prostate gland. Because she ain't giving you nothing. You putting out. You see what I'm saying? You shooting out of your penis hole vitamins, minerals, amino acids, and enzymes. Yeah. So you're doing that all the time, and you're not eating the foods that have nutrients to put back in the prostate gland. So the prostate gland become either mushy or too hard, and in long term, you feel you could have killed the pussycat. The pussycat say, ha, 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 you can't kill me, sucker. Baby coming to me, you know. Big head coming to me, you know what I'm saying? You can't kill me. So then what? The pussycat that you so want to kill, it kill your ass long term. You see, it kills you because they make you become impotent and have ED. ED, Damiana, ashwagandha, sex enhancers, ginseng, ashwagandha, Damiana. Damiana is a herb that we use for men who is tired and say they go home and they had a long day at work. And they go home and the wife say, yo, John, I'm feeling horny tonight. And John said, oh God, baby, I'm tired. She said, well, oh God, I feel I want some real penis tonight. Give me some penis. A whole day aquarium for it. John said, oh God, baby, I touch. He said, hey, no, yeah, I love him, Patrick Dells. I get some Damiana for you, boy. Patrick Dells told me to give you some Damiana. He said, yeah, all right. Let me make a cup of tea. I got Damiana for you. And she made a cup of tea for him, Damiana. What? He ready. So Damiana is used for us men when we go home and we're not in the mood because we're tired. Damiana pick us up. And then we say, yes, mama, we're ready. Come into the shelter. Yeah? Don't forget that now. Wonderful. Now, so ginseng is good. Then we have Mariapuma. Puma. Sorry. I hope I spelled it right. Then you have what again? Katuba. This is a herb from Peru. This is one of the best herbs for that too. Honey goat weed is not all that great. Tibulus is not all that great. See Katuba? You see Yohimbi? Yohimbi is good too, but Yohimbi is so potent that if you have troubles in the heart and you have high blood pressure, you can use Yohimbi. So there was a brother in Grenada who had a young girl too. And he was about in the 60s. Yeah? And he go and he takes some Viagra, Cialis. And he gone. But he didn't know that Viagra and Cialis is drugs. They're dangerous. But Yohimbi act as Viagra. So Yohimbi also can put you in a state whereby, yeah, baby, woo, I'm feeling good, yes. And you're sexing nice. You know when you're about to have ejaculation, your heart has to beat fast. You see Yohimbi? You make your heart beat faster. And you say, oh God, oh God, oh God, you're dead. This herb. And then the woman going to push you off because you've been using these herbs. So you have to be very careful with this herb called Yohimbi if you have high blood pressure. Yeah? But it's very good for sexual intercourse. We have it in a product called Men's Delight. Yeah? There's another herb we call in Grenada called Babande. Babande. I never spell it right. Yeah? I use Babande but in my products, but Babande is more for cleansing. Yeah? Of the liver too. And because the liver is the wood element and the kidney is the water element, we must go to the kidney. Yeah? Because some men, when they go into the vagina, they have weak kidneys. So they come fast. We call it premature ejaculation. But if you have you're older man and you have impotence, we can use these herbs here. Yeah? If you have ED now, yeah? You have to go to what? Stone root. If you have ED, we got to go to what? Ginkgo. If you have ED, we got to go to what? Ginger. If you have ED, erectile dysfunction, we got to go to what? Cinnamon. If you have ED, we got to go to what? Gota cola. If you have ED, we got to go to what? Garlic. Because garlic is an aphrodisiac too. It cleans the arteries. Yeah? So all these herbs here and more is good for when the man is suffering from erectile dysfunction over here. Circulation formula. Yeah? If you want to keep the prostate healthy, prostate cleanse, or yeah? Now, if you're coming too fast now, yeah? If you're coming too fast, you're going to the pussycat and you say, oh God, a pussycat, sweet boy, you're sweet woman. Oh good. And I can't hold it. You do so, we give you what? Romania. So you see, we know. So we have to know what is going on with the man. Because some man will go and the woman will give him some two pieces of wine. And he said, hold on. She said, why? Oh God, I'll come out. Oh, she said, you're coming already. Yeah. Oh God, hold on. No wine. When you want you to wine because you come too far, your kidney weak. got a stroke in your kidney. You understand? And then, lots of men, they feel when they go on and they're having sex with a woman, and she's making a lot of noise, oh God, yes, it's sweet. Ooh, yeah, do it that way. Yeah, yeah. And they feel good. But then, she didn't get no orgasm. Making noise doesn't mean to say she have an orgasm though. And then about 3-4 minutes, you ejaculate. And it's about, you come already? You see, and then here, you know now. You come already? You go to sleep. And that is the reason why we tell men that if you ejaculate too regular and you keep on falling asleep, when you get older, you will get Alzheimer's disease. From that. That's when you fall asleep. Because that brain ain't functioning. As you ejaculate, all the strength gone. When you're going to sleep. And she waking you up. You ready for the next round again? Maybe you can't make a next round. But you know why? Because you kill your prostate gland long term. So you have to learn. Once you pass the age of my son over here. Come son, come over here. Come on, my son, I'm my son. I'm my big son.
Hey, what's up?
How much round you can make? Don't lie to your father. Don't lie to your father, son. You can make 5 rounds one night?
Yeah, I can make 5.
Wonderful. Yeah? How old you are?
I'm 23.
23. 5 rounds. That's my son right here. Yeah? Your father can make 5 rounds?
I don't think so.
You're damn right about that. Your father can't make 5 rounds because I'm young like him. You know what I'm saying? He is 23 and he is producing sperm every day. You see what I'm saying? But I warned him. I said to him, yo, son, you have to learn from now, because if you're spitting 3-4 times per night, long term it's going to catch up with you eventually. Because at the end of the day, you keep on making your prostate do like that. Prostatic fluid. You see what I'm saying? When you get to be 30, you do not produce sperm every day. You produce sperm every 3 days. That's Chinese medicine. So you can't spit Monday, Tuesday, Thursday, Friday when you're 45. Yeah? That is the reason why you are suffering from ED. And there's lots of them. So you have all these sex pills on the market that you all have to take to have sex. When if you had learned that the prostate gland is significant in our sexual health, if you knew, like I'm going to teach my son, yeah, and my other children, if you knew that when you get older, you're going to be 60, and then you go, and the woman say, I want 2 rounds. You say, hell flicking no. I ain't making no 2 rounds because I'm 60 years old. I give you 1 round, I give you an hour. If you can't be satisfied, what my kid feel? I ain't going no 2 rounds. Because when I reach 70 and 75, I do 2 and 3 rounds at 60, and I get you have your still working. You understand? So when I do, I say, yo, Patrick, Monday night you ready? Yeah, baby, I'm ready Monday night. Tuesday night she come, yo, you what? Nah, I ain't want nothing. Why? Because why? My age bracket. She come Wednesday, you want? No, I ain't want nothing Wednesday. You alright? Yeah, baby, alright. Okay, Thursday night you come? Yeah, I'm ready for you. Every 3 days. So I know that if you get to be 70 and 80 and 85, you can still function because you took care of the reproductive system. Don't let anybody tell you when you get older, you can't get an erection. That's not true. You cannot get an erection because you're not eating properly. Your veins is clogged up. Yeah? Your testosterone drops. Yeah? And you feel you could kill 3 and 4 pussycat in a week. You think what happened? And then you gotta go and take Viagra. You gotta go and take Cialis. And then you go in the box and you're doing you're taking Ilensopril, you're taking Alferapin, you're taking all these beta blockers, which when you have high blood pressure, and that messes your penis too. So you gotta go and take Viagra, and you go in the box and you're just doing your shit, and you're doing it, you're tired, 2 minutes but you're blowing. You come here, no, and you say, and you're ready to ejaculate your body. Oh God, Oh God! And you're dead on the box. Follow me. Come to the store. Get your prostate cleansed. Prevent your prostate cancer. Prevent BPH. Prevent prostatitis. And only then we're going to save our black men from coming down with prostate cancer at an alarming rate. We have a new song coming out. We are going to the Spotify. Me and my two children, me and my son and my daughter. I want you all to go and buy that song for me, please. It's called A Better World. Yes, son? Patrick Dell's Better World. We have a t-shirt coming out soon. And we have a song. We're going to go and buy the song on Spotify, okay? It's A Better World. Me and my daughter and my son. It's a better world. Don't forget. A better world. We are. Better world. A better world. Mandisa Dance, Patrick Dance, and Terry Dance. In a better world. We want a better world. A better world. We all are marching. A better world. We want to live in. A better world. We all are marching. A better world. Oh, a better world. Nations war against nations every day. Pestilence and hate, the game they play. Poverty, crime is the norm, I hear them say. Forget all you say, hell no way. Religion cause division, and politics is confusion. Everyday child molestation. Oh, what a world them have we living in. So I want to tell them a better world we all imagine. A better world we want to live in. A better world we all imagine. A better world, oh Lord, a better world. Ask yourself if that's the way y'all ready to be. Only pain, suffering, misery. Man is lost, man is own injury. Only child love can set us free. In this world, pure corruption, I say pure greed and crap education. Preachers deceiving all the nation, yeah. So look out for the mark of the beast and be aware. A better world we all imagine. Oh yeah, yeah. A better world we want to live in. A better world we all imagine. A better world. Oh, a better world.
Yeah, it's either manna or quill. Either you plan or you fail. Our nation's examinations approaching faster than hell. You better study hard on what these questions entail. Just in case you don't, I'll give you some details. Come on, my brother, let's cherish our females. Love thy neighbor, you never know who means well. God has a plan of that, I'm sure, like some seashells. So let's love and just be real. Yeah.
A better world we all imagine. A better world we want to live in. Oh, a better world we all imagine. A better world, oh, a better world, Lord, a better world we all imagine. A better world we want to live in. A better world, can you imagine? Oh yeah, a better world, oh, a better world.
There's a mother living in an abandoned building with 5 girl children. Is that a better world? You tell me.
A better world, oh, we can imagine. A better world, let's do it for the children. A better world, we all imagine. of us imagine a better world, ain't it, brother?
Yes.
Yeah? All of us imagine a better world for our children to survive. There's a mother living in an abandoned building with 5 girl children. Is that a better world? No, it's not. No, sir. Bishop.
Yes, Father. When things are good, we need it. But when things are bad, we run to you. We need it. Some people want to conquer the world. But no, we need it. We need it. Yeah. There's so much trouble in the world, affecting little boys and girls. Oh, Father. Yeah. Everybody want to use each other, but nobody want to love their brother. I come to you humble in a prayer, so please don't turn your face away, oh Father. No. The crisis is on display, while some people can't seem to find a way. Father, shine down your love. Shine down your love. Oh, Father, the people need it. Right now. Shine down your love. Shine down your love. Father, the people need it. Yeah. Everybody want a revolution, but no one seems to have the solution. No. The weak and the poor, them I feel it. In your book of heart, you did reveal it. Yeah. Many are only 7 lives. Everlasting life should be the price. So, Jaja. Yeah. If the nations come to you and pray, please come, but turn your anger away. So, Father, I'm begging you, shine down your love. Shine down your love. The people need it. Right now. Shine down your love. Shine down your love. The people need it. Yeah. Oh, Lord, people need it. People need it. We need it. Oh, Jehovah, the people need it. 7 need it.
Yes, we need a love. Give thanks, you know. A big son, man. Yes, sir. You good?
Yeah.
All right. Don't forget to hug your children and love your children, man. Hug your children and show them you love them on a regular basis. That's the key. You know, keeping the family intact. The black family. Don't forget. The black family have been destroyed. You know what I mean? From slavery and more. So you have to keep the black family alive and raise your children in the way of the Most High, you know? They never depart from that. Blessings. Keep the black family alive. Come to Ambrosia, get all your stuff that you need, and don't forget to buy black and raise the rate. Don't forget we need to get ourselves together. The black community, look at Basino Faso. Yeah. Take example from these brothers, man. We have to get together because everybody's coming into our community and doing business and taking our money out. And the community become richer and ours become poorer. Learn that, and black people learn to live together. Because you have to what? You have to what? You have to come together before you can integrate with anybody else. If you don't have unity among yourselves, there ain't no way you're going to have unity with other people. Don't forget that. We love all people, but we're here to give our people the incentives so that we can work together and control everything in your community. We have too much of our children and our black brothers in the prison system. Prison life is not easy. Don't forget, build up the black community. Let us own our own businesses in our community and keep the money in our community so that we could raise our children the right way. Yeah? Blessed love. Give thanks. Here we going to Spotify. And don't forget, Better World, Patrick does. Tarek Dells and Mandisa Dells, Sidney Mills is the producer of the tune. You could go to Spotify and look for that tune, A Better World, okay? You need to work and live in a better world. We got some t-shirts coming out soon. Blessed.
Blessed.
Give thanks. All right. Yeah.